The next phase of the extremities is going to be your lower extremities, or your hip, and you're going to see how there is a definite tie-in with your hip joint, your pelvic girdle in other words, and your lower back. We've obviously got the head of the femur, which is going to be your leg bone. How it comes into here, your ball and socket over your hip, which is going to be your triaxial joint. You have different types of movement. You have the, looking from the anatomical position on this picture on the left, your right is going to be your abduction and adduction. But then you can't ignore the fact that if my knee was flexed, or my hip was flexed in other words, I've got AB out here and AD right here in terms of horizontal AB and adduction illustrated right here. You have internal and external rotation. So even if I was having my hip flexed, I could have external versus internal rotation of the hip. Actually, this would be external. This would be external. This would be internal. I said that right backwards. On the standing in the anatomical position, I've got external versus internal rotation. You have flexion and extension of the hip. So on a profile shot here, I'm going to have flexion of the hip, extension, and hyperextension of the hip. The muscles that actually flex the hip are your iliopsoas muscles. You don't pronounce the P, it's iliopsoas, I pronounce it. They crisscross from the lower back across into, through your pelvic girdle, and into your insertion portion of the femur, which is your leg bone. It's very, very interesting. See, you can see how these muscles of your legs crisscross through the pelvis and pull on that lower back. You see your L5 lumbar vertebrae, 1, 5, 4, 3, 2, 1, and your lower portion of T12, okay? So think about that for a second. You have got these hip muscles that pull on your lower back muscles through that pelvic girdle. So think about how important that these muscles that flex your hip, it'd be important they don't get overly tight, so we're going to make sure they stay stretched out, because if these muscles are constantly pulling this way, they could actually take your pelvic girdle and pull it this way, and then this is not a good postural position to be in. So do not underestimate. People talk about the back. They think about the muscles of the back. You see a lot of people doing like the back extension machines and all those types of things, working those erector spinae group. But we can't ignore how important it is to be flexible in the hip flexors as well as the other muscles that attach in the actual pelvic girdle. Your hip flexors also include not only your iliopsoas, but you also have your rectus femoris, okay, which is actually going to crisscross, which is actually right here, into the pelvic girdle, okay? It is what we call your two-joint muscle. It assists in flexion of the hip when it is in a stretched position, okay? And we're going to talk about that here a little bit in further detail with two-joint muscles. Your hip abductors are situated right here, and you can kind of look over that. You got your piriformis, which is very, very important to be aware of. You'll see a lot of piriformis tightness when you'll see people do the stretch where they bend their knee and rotate medially, because it actually helps with external rotation as well as abduction. And that's why you'll see a lot of piriformis right here. This muscle is a lot of times tight. Your adductors, or your growing muscles, are located on the medial side of your femur. And it's very, very important to understand what they do is simply bring your legs together. You can see how they once again pull on that pelvic girdle as well.